Hello everybody, we are a team of doctors from the Kinder Women's Hospital, Bangalore. I am Dr. Geeta and they are my colleagues Dr. Yasmin, Dr. Aparna and Dr. Lakshmi. So today we are here to discuss a very important but a rare but a very important complication in pregnancy, that is HELLP syndrome. So we'll discuss the various aspects of the HELLP syndrome, what it is, what causes, what are the various signs and symptoms, how to diagnose it, how to treat it, and finally what is the outcome of the HELLP syndrome. Let me begin with a brief overview of what is HELLP syndrome. So basically HELLP syndrome is a complication. It's a serious complication that happens in pregnant mothers who already have severe hypertension. So it's a complication of severe hypertension in pregnancy. So HELLP syndrome basically stands for whatever are the various complications that develop in this syndrome. So it stands for hemolysis, which is breakdown of the red blood cells. Now these red blood cells are the ones that carry oxygen from the lungs to the rest of the body. There is elevation of liver enzymes because the liver function is affected. Then low platelets, which is lowering of the platelets, the cells that are responsible for causing clotting in the body. So now, what are the various symptoms? How can you come to know? So because now HELLP syndrome develops in a patient who already has a pre-existing hypertension, now many of the symptoms are going to overlap and sometimes can be mistaken and ignored, which should not happen. So the main symptoms that can happen is severe abdominal pain, especially on the right upper abdomen where the liver is located. You can also have severe headache. There can be blurring of vision, nausea and vomiting. A lot of people develop a lot of edema, that is swelling of the legs. There can be pain while taking deep breaths. Now other rare things that can happen is nasal bleed or uncontrolled seizures. So now what can cause? We still don't know what causes the HELLP syndrome. We know that it usually happens in women who have severe hypertension. So 1 in 20 women who have the hypertension, that would be about 20% of the women with hypertension develop the HELLP syndrome. Are there any particular people who are at risk? Of course, the people who already have hypertension, if you're a mother who has delivered before, that is if you're a multigravida. If you have pre-existing conditions like diabetes or a kidney disease, you will be at a higher risk to develop this particular complication. Dr. Yasmin will now further talk about the various complications and how to diagnose the HELLP syndrome.
So I will be taking you through the complications of HELLP syndrome. So what are the complications? The complications can happen for the mother as well as for the baby. So for the mother, will have coagulation disorders can be there. She might have certain changes in the blood. So because of that, after delivery, she is expected to breathe heavily. Then again, because of the same complication, she may develop kidney and liver failure. Sometimes what happens, the afterbirth or the placenta, so after delivery or before delivery, it will separate. So that is called the placental abruption, which can lead to death of the baby also. Sometimes, again, the lungs can be affected. There will be fluid collection in the lungs, which is called the pulmonary edema, which can cause respiratory difficulties for the mother as well. So these are the various complications for the mother. Now coming to the baby. So for the baby, what happens? There is more chance of preterm delivery for the mother, because of which the various complications of prematurity will be there. Again, those babies will have low birth weight and then more chances of cesarean because of this. Another one very, very important complication is there can be chance of IUD also for the baby. Then after the delivery of the baby, what happens is the baby's blood parameters also will be affected. So we need to check on those parameters because sometimes the coagulation issues will be there, and then baby also can have bleeding disorders. So these are the various complications. Again, it can be mild, moderate, severe depending upon the symptoms. Now coming to the diagnosis. So how do we diagnose? As Dr. Geeta has mentioned already, based on the signs and symptoms, we will diagnose. So any pregnant women with high BP, with swelling in the legs, or if they come with visual blurring, or suppose they have history of fits, then we will think about HELLP syndrome. Any pain in the upper abdomen, that has to be always taken into consideration. And then after that, what usually we will do, we will be doing some tests to confirm the same thing. So what we do usually with a general complete blood count, liver test, kidney test, and then another one thing we will do is the coagulation profile. Sometimes in severe cases we have to do the ultrasound of the tummy also, because that will tell us whether the liver is enlarged or not. Again, another severe cases we have to go for even MRI also to diagnose. So these are the various modalities. How do we diagnose? Now I give over to Dr. Aparna.
I would be talking about the management and the prevention of HELLP syndrome. So once you are diagnosed to have HELLP syndrome, delivery is the only treatment option which is available. So to deliver, it is mandatory to have a tertiary care center. What do I mean by tertiary care center is the facilities for ICU facilities for the mother and the baby. Since it is a life-threatening complication, ICU backup and the blood bank facilities are necessary to deliver. So mode of delivery, whether it is a normal vaginal delivery or a C-section, depends upon the stage which you are into. If immediate delivery is possible, you are having a favorable cervical dilatation and condition, vaginal delivery would be possible. If it is not favorable, then it would be a C-section. Apart from this, the other supportive treatment that is required would be corticosteroids are needed to enhance the lung maturity for the baby, and magnesium sulfate therapy may be required in order to prevent the development of seizures and also to have a neuroprotection for the baby. And most importantly, we need the blood and the blood products. Not only the packed red cells but also the plasma and the platelets may be required. So component therapy is very essential when we are planning to deliver a mother with HELLP syndrome. So coming to the prevention, is there any way which we can prevent? There are no proven measures which are currently available to prevent the HELLP syndrome. However, regular antenatal checkup is the key factor. So identification of hypertension during your regular antenatal visits, treating the hypertension adequately and controlling it at the right time will prevent most of the complications which are associated with hypertension in pregnancy. And only proven therapy for those who have already experienced hypertension in their previous pregnancy or any bad outcome is addition of aspirin. Around 75 to 150 milligram of aspirin is started around 12 weeks of pregnancy and it is continued until 36 weeks of gestation. Apart from aspirin, diet also plays a very important role. A well-balanced, nutritious diet which is rich in carbohydrates, proteins, vitamins and minerals and low fat is recommended, and a low salt intake of less than 2.4 grams per day can significantly help in reducing the diastolic blood pressure in the mother. So apart from this, regular physical activity of at least 30 minutes brisk walking 3 times a week at least has been recommended in order to prevent the further complications of hypertension. And adequate resting and sleep for at least 6 to 8 hours will help in combating the complications of hypertension in a mother. So now moving on to the prognosis or the outcome of hypertension or HELLP syndrome.
I'll be talking about the outcome or prognosis of HELLP syndrome. First of all, let us talk about the outcome for the fetus. Outcome for the fetus depends upon the gestational age at which we are delivering the fetus, severity of the disease, and whether the HELLP syndrome has been treated or not. On an average, if the baby weighs approximately above 1 kg, the outcome is as similar as a woman with a fetus without having HELLP syndrome. And prematurity is an important factor which determines the outcome for the fetus. The baby may develop prematurity-related complications like breathing difficulties, vision problems, and developmental delay. Now coming to the outcome for the mother. Outcome for the mother depends upon at what age we have detected the disease, and early detection and treatment is the strategy, and it has a good outcome in 99% of the women with HELLP syndrome, and most of the times delivery is the safest mode of treatment. After delivery, most of the symptoms of HELLP syndrome will subside within 3 days after delivery. Now coming to the recurrence, how many women will have a repeat HELLP syndrome after having one episode of HELLP syndrome? It is